Welcome to everybody who's on the call today. We're really excited that you're joining us for this launch. It's the conclusion of a 3-year initiative. As I said, my name is Dr. Gillian Middlestead. I'm the director of the Partnership for Air Matters, and we're a program affiliated with the Tribal Healthy Homes Network, and I'll explain more about that in a few minutes. I'll be facilitating today. I'll talk for about 10-15 minutes, and then we're going to go in. I'm just going to kind of cover the context of the why and the how we produce these. Then we're going to show 3 of the 11 videos. And then the most important thing is we're going to talk about strategies for risk communication and strategies for distribution. We're going to share what we have tried, what we've learned from tribes, and we also hope to use polls and Q&A to also hear from all of you who are doing what I'm guessing is similar work and with the same objective. All right, so but before we begin, I just need to thank and recognize our partners, our funders, the tribes who collaborated with us, where we had focus groups. So you can see it's we had a pretty great collaboration. If anyone from Tulalip tribes, Ashley, I'm not sure if you're on the call, but as I recognize these organizations, please feel free to turn on your camera. I'm going to go ahead and turn mine on. I believe it's visible while you're also seeing the slides. Ashley Schmidt and Tulalip Community Health were, Tulalip shows us they're our partner organization, and they were also one of the sites of the focus group, and they manage the grants. So many thanks. Tribal Healthy Homes Network, Eileen, Krista, and Darian have worked with us or for us for a long time, and they were also central to the development of the project. Hello, and Tina, if you want to go ahead, and Kiernan. These are 2 new faces to Tribal Healthy Homes. Kiernan is our Climate Ready Housing Coordinator. Tina is our Program Assistant. And they joined us just since 2024. Lake City Collective, I don't know if Cesar Garcia is here. If you've joined us, feel free to go ahead and come off camera. Great collaboration, and he is the person who did all of the Spanish translations and the Spanish voiceover. Meloria Media, Heather Moffat, if you are out there, if you want to go ahead and say hello. She was the creative force behind, well, Eileen also did many of the animations, and Heather put all of it together using the software, which was, let's just all say, it was no easy task. EPA, thank you. The EJ program, we had a community problem solving grant. Andrea Denny and Jessica Montrose were our project officers. And then, of course, the tribal air staff in Region 10, Sandra, Gretchen, India, Aaron, anybody else I've left out. They've been supportive of our programs. And then our focus groups in developing these were at the Tulalip tribes, the Muckleshoot tribe, also in Washington, and the Porch Band of Creek Indians. Tiffany, I'm not sure if you are on. At any rate, just want to say that this was truly a group effort, as you can see. So before I jump in, very briefly, I want to introduce, there's a lot of names I don't recognize today, so I want to give you just a short introduction to who we are. This picture is the Eastern Band of Cherokee, and Eileen Gagney, our technical advisor and trainer, was providing a toolkit training this is K through 12 teachers. All of the teachers received toolkits to give to the kids in their class. But this picture really embodies what we strive to do, which is we partner with tribes and with environmental justice communities to share what we have learned from other communities, to learn from them, and then to share that among others. And as you can see, this guy is having a blast with a home radon detection kit. So we love this picture. The Tribal Healthy Homes Network, if you're not familiar with it, we're based in Region 10, funded by EPA. And through the leadership of the Tulalip tribes, we're able to function training, technical assistance, community-based programs with tribes. We focus mostly on workforce development. And since 2010, the Partnership for Air Matters was founded. It's a separate nonprofit. It's a 501c3. It's also sort of your host today, because Air Matters, our mission is just to focus on resident engagement and empowerment. And we're really focusing on residents of substandard housing who have now increasingly been hit by existing indoor air hazards and now climate hazards. So we focus on reaching those communities. So I just want to, before we get to the actual videos, I have a couple slides next. I want to talk about the why. the context of, as with your organizations, you probably do outreach, you might do social media campaigns, health fairs, a variety of different methods to engage your most vulnerable population. That's what we've been trying to do for 20 years. And these videos came in response to a need that we had identified kind of year over year. Going to go back, though, about 25 years and explain where our journey began. If you work with us and if you've worked with me, you've seen this story. And it is core to who we are and what we do. It's about 25 years ago, I was working and still do work with the Tulalip tribes. This is a Bureau of Indian Affairs building where the superintendent actually used to work close to one of the Tulalip Indian School. So not a great history there. The building also then would backflow with raw sewage periodically. One of the legacies of the treaty era was forcing tribes to live in explicit areas that may or may not have been really habitable for building healthy homes. And in this case, it was a high water table and soils that didn't drain well. So raw sewage would backflow into the basement. And the building also had asbestos, lead, fungicides used. So essentially, we began to have a series of illnesses throughout the upper and lower floors. My office was that little tiny window you see on the bottom left in the corner. 27 different species of mold, including Stachybotrys, had developed. And everyone in the building began to get sick. And as you can see, there was upper and lower respiratory symptoms, infections. But we also had many miscarriages, and 11 of 11 pregnancies while we were in the building were all preterm, including 2 of my own. And many of those mothers would ask me, what was it? Was it the mold? Was it the asbestos? Was it the lead? Was there the fungicide? Was it dirt? Scientifically, we don't know which has a causal pathway to those adverse outcomes, including the fact that many of the children went on to develop asthma, Asperger's, just reactive airway disease, a whole variety, including my two of my 3 kids developing asthma. The point of this slide, though, is that the Tulane Board of Directors had the leadership to condemn the building and get us moved out of there. But my tribal friends and colleagues and people in other tribes, I began to understand that there were no other places for people. If this was their home, there was no other home to go to, right? You couldn't move down the street because there was a wait list. Or if you did have an open home, it might have similarly compromised conditions. In rural, cold climate, communities of color, as all of you know, there's very similar issues with substandard housing that may have a history of maintenance issues that have been neglected. So it's one thing to say, yes, we want to remediate, but there's thousands of homes where we're not going to get in there yet. I want to share a quote with Dean Henry. He's Tulalip, he's the OSHA manager. He is our visionary, he's our lead. We work closely with him. It's not a normal week if you haven't had a call from Dean in his truck out in the field talking about something he's seen and wants to report. As he said, quote, people are living in these homes. It starts from the little ones on up, the babies on up to the elders. They all have some kind of asthma. This is huge. They've been breathing this stuff for years. So Dean is our champion. He likes to describe that we're all in this canoe together. So the question is, so we've got these thousands, if not millions of homes with compromised conditions. People on this call are here today because you're probably working on efforts to do retrofits, remediation, post-rental inspections, you name it, all the different interventions or pathways. But so where does this idea of just short animated explainer videos fit in? Why does it matter? Obviously, we all know, well, of course, it's an outreach tool. But it also goes behind the idea, fundamentally, that if we can't get into millions of homes, how do we empower the people in those homes? How can we make them our partners as opposed to just someone we are studying or someone we are advocating for? But so we're building in power within those communities, we hope. These videos aren't necessarily, they're not going to do that, but we hope they get people towards information that will help empower them. So there's also just a technical explanation of why would we choose, when we got the funding, why are we going to choose an animated video as opposed to a print material, a social media campaign? So going into the literature on risk communication and learning, it was very apparent pretty quickly that the animated video, which has grown rapidly, of course, is shown to increase engagement of the viewer. We tend to stay longer in the message. It heightens our understanding by statistically significant margins, and they're just more readily accessible. You can view them on your phone. You can integrate them into any social media app. And so as a result, they're just more easily disseminated, right? But the other part that is compelling is that videos actually, about 65% of the population is a visual learner, and about 30% are auditory learners. So as opposed to a print media only, an animated learning is going to capture people, and some of those learners are going to be able to stay longer in that space and get more out of the lesson, or not the lesson, but the information. But there's also a moral explanation for why we want to do videos, why we want to reach out. And that is, at this state in 2024, we still do not have enough federal investment in tribal nations and in environmental justice communities. So you have millions of residents, of people. I hate calling them residents, it's our public healthy term, but they're people, they're families. They're living in substandard homes that, at least in our lifetimes professionally, will probably never receive a healthy homes assessment or an asthma home visit. Subsequently, they're not going to have a one-to-one of someone saying, here's what I see in your home, here's the individual risks that apply to you, here are actions you can take. So in the absence of that, do we just churn out more flyers? Do we try to do more health fairs? Yeah, we do all that, but maybe we can ideally empower them. This slide appears to be blank, so we'll just move on from that. Here we are. So the other reason is we want to emphasize that this is not a panacea. We recognize that there's very few factors, whether you're a homeowner or a renter, but particularly if you're a renter, there's so many risk factors in the indoor environment that are outside your locus of control, right? You have income factors, your rights as a tenant, pressures from your landlord, access to resources limited, either geographically, economically, you just don't have access. This particular table, I'm not going to read it, but I want to show you, we often review this when we're preparing grants, and we actually generated this. These are all structural and socioeconomic factors that a tenant, by and large, has absolutely no control over, right? The age of the ownership status, the condition, its maintenance history, the materials. Was it built with, all the formaldehyde emitting materials? Was it actually properly insulated or not? HVAC systems, zip code, the environment in which whatever's going on in the ambient air is going to infiltrate. Your occupancy rates. Couldn't have 4, 6, 8, even 10 people in a home in some cases, right? That's not uncommon, and that affects the indoor air chemistry and the emissions. The heating and the cooling systems as well. So those are all outside the locus of control, which means we don't want to be disingenuous and say, we're going to come and we're going to try to address these. This is a societal push that we're all working on. In the meantime, maybe we can give some information that will inform, engage, and empower. So this illustration right here on the left is our Smoke Matters toolkits, and on the right is our Air Matters toolkits. I share this slide. Today's video is not about our toolkits, but it's one approach that we have used to help residents physically see, measure, or monitor hazards. It actualizes risks when you have a hygrometer, a CO detector, a moisture meter, right? It puts something in someone's hand and helps make a risk real. The toolkits, you can use the videos with or without a tool. If you want to distribute carbon monoxide detectors, you can use the carbon monoxide monitor. You can use the moisture meter for wood burning homes, or the chimney thermometer, or a green cleaning kit. But I want to emphasize our toolkits are a fantastic program. We hope you learn more, but the videos are just essentially meant to help people understand a specific issue. All right, I've got about 2 more minutes. Let's see. Just briefly, the impact of our toolkits, just coming up on 3,000 toolkits distributed since we began. 9 different federal and community-based organizations have ordered just under 300 toolkits. 50 different tribes have taken the initiative to get funding, design a program, all sorts of cool programs, and have distributed 2,500 kits. Which also means, since there's cue cards, there's 31,000 little printing cards in people's hands all over the country. We have not been able to do evaluation to know how much did people learn from those cue cards, but we made the assumption that some of them ended up in the trash, some ended up in a pile, maybe a few people read them. Part of our approach to the videos was to say, let's get something more powerful here. All right, and then just a map. This is interactive on our website. This shows all the communities on our website. We're slowly uploading an interactive map where you can click on this and see what type of kit was ordered and how many. All right, so we're about to get into the videos themselves. I just want to take a brief note to explain why did we choose the 11 specific topics that we did? What was our rationale? And I want to say we did a course. We work in the healthy homes and indoor air space. So we looked at the literature, we looked at the public health data and the epi data to see where the burden of different hazards was. We used that to drive which topics we would choose for our videos. So on the left, I realize this isn't really legible. Happy to share this after the webinar, and of course this is recorded. But so on the far left column, you can see these are the central topics that were a dominant hazard and were tied to a specific tool that we or others can provide related to that, right? So your pesticides, we provide a non-toxic pest trap, a CO detector, household dust, we do microfiber cloths and green cleaning. And again, so here's some of the others. Radon, lead. We initially for years had the self-administered lead test kit. 3M's no longer producing them, as many of you may know. And as of right now, there's not another affordable EPA certified lead test kit, which is kind of to be determined what will happen in the future. So essentially, you can see for each of these, we tried to provide a tool, but these are also the topics of our videos. And if I go back for a minute, we identify what was the targeted behavior change, not targeted knowledge change, and what was our public rationale? What was the underlying epidemiological data or scientific data? All right, so with that, we're going to get into the good part. I think I'm 1 minute over, not too bad. There is a QR code coming up. I'm also, this is just the link here. What I want to show you with this screen capture is that when you're at our homepage, you go over to individual families and you drop down to resources and videos. So you can then open all 11 Air Matters videos. We did a few Smoke Matters videos with a separate budget, and then all 11 videos in Spanish are accessible here. Most importantly, there's a QR code. For today, I'm sharing this just to show you that for us, the QR code is what we're going to put on tools. We're going to put it on our DIY fans. We're going to put it on the box when someone, they get a heat pump and we come in with some other tools. And so we provide the QR code on that. Or if someone's getting weatherization, we come in with, maybe a green cleaning kit to reinforce, what's now not going to be circulated in the air. And how can you use this? The point is the QR code to us is probably the best mechanism that you can literally attach to a tool that you distribute at any of your events.
Welcome to this green cleaning kit. In this video, we will walk you through what it is, what it does, and what you can do, along with a little context as to why you need it. Let's get started. Did you know we are surrounded by chemicals? It's in our water, in our food, and in our air. We bring a lot of chemicals into our homes. Often, these are products we use every day, such as bleach, dryer sheets, or disinfectant wipes. Did you know, out of the 84,000 chemicals that have been introduced into the environment, only 200 have been tested, and very few have been tested for their safety on human health? That's a big number, but you've taken the first step to make your home healthier. Let's walk through what you can expect from this kit. What is in this kit? This green cleaning kit uses products to remove dirt, dust, and germs without the use of harsh chemicals. Cleaners in the kit are based on 3 common and safe ingredients: baking soda, or Bon-Ami, white vinegar, and dish soap. That's it, so you can be assured that the items in this kit will not harm you and will make for a better, safer home. What does this kit do? How does using this kit make you safer in your home? By using the products in this kit, you can reduce any unnecessary exposure to chemicals. Chemicals that may be linked to asthma, fertility problems, and cancer. So what can you do? Start by following the recipes included in the kit. Tips. Follow these tips when choosing household products. 1. Avoid products labeled warning, danger, or poison. 2. Use cleaning products with safe ingredients. 3. Avoid fragranced or scented products as they may contain petroleum distillates. 4. Read the label and follow the instructions carefully. Only use the amount of cleaning, sanitizing, or disinfecting product as directed. 5. Avoid using antibacterial products unless absolutely necessary. 6. Never mix chlorine bleach and ammonia, as doing so will produce a deadly gas. 7. Keep all household products out of the reach of small children. Now that you know more about this kit, how to use it, and a few tips and tricks around household chemicals, you are ready to use safer products to clean your home. Start by following the recipes included in the kit. To learn more, go to www.yourairmatters.org. This project is brought to you by the Partnership for Air Matters and funded by the U.S. Environmental Protection Agency. Thanks for watching.
I'm going to shift over to Eileen Gagney. Again, she's our technical advisor and trainer. And Darian Benally, who is the narrator and the voice here, as well as someone who has worked with Tribes on Risk Communication, as well as in her higher education. Here we're talking about distribution of the toolkits and the cue cards. We have now shifted to doing all of these same pathways with the videos as well. So what we're drawing on today is just the our preceding work. And now that these are done, we're excited that all of these strategies will incorporate the videos.
So I'm the technical advisor and trainer, and I travel all throughout the United States, mostly in the Pacific Northwest, doing trainings and helping folks distribute the kits. So as you heard, it's about informing, engaging, and empowering folks. And here you see this was at one event. This was at Tulalip in the administration building. And we did a huge event in terms of distributing the Smoke Matters toolkits with the do-it-yourself filter fans and really talking about how folks can protect themselves during a wildfire event. But there's so many ways that these kits can be distributed, whether they are the Air Matters or the Smoke Matters. We go to health fairs, environmental fairs, obviously community events. They could be at schools, they could be in gyms, they could be at libraries, they could be at health centers, they could be at admin buildings, which is where this one was. Any number of things. I've actually done a distribution and training event at a general store in the parking lot, because everybody knows that at 5 o'clock, everybody goes there to go get their food for dinner. And it was a fabulous place to distribute the kits. Next slide. Oh, there we go. So one of the things we're going to discuss here is the high-risk individuals. So in this particular case, this was at the Alaska Native Health Consortium up in Alaska. It was at the medical center. And as pediatric respiratory patients were discharged, they actually were given a kit that actually flew with them back to their individual villages and towns where they could then use them and help create a healthier home. We also had areas where we did, they were distributed through Meals on Wheels, especially during COVID. That was a very creative solution by Tiffany with the Porch Band, and that was fabulous. And then certainly they can be, given out to patients with newly diagnosed asthma or COPD. But actually, anyone who has any kind of underlying health condition, those most at risk. So obviously, children, pregnant women, children with asthma, any elders, anyone with COPD, asthma, any kind of a chronic or respiratory disease, all these tools will help them have a healthier home and a healthier lifestyle in their home. Next slide, please. Schools, this was done in a very remote village up in Alaska in the school gym. And the whole town came out and we talked about all the tools in the kits, why they're important and how they can be used. And I had a great discussion, and actually it led into from green cleaning into, they only have one general store here. And they were like, well, that's all we can get. And I'm like, well, you have a lot of power. You can ask the people to start buying other products other than the commercial grade toxic cleaning products. And baking soda, vinegar, soaps are very, very inexpensive, and they'll save you money. They're a lot better for your indoor air quality, as most people or a lot of people do know that exposure to a lot of chemicals can lead to cancer, all sorts of things we don't want. We have enough of it, right? So school nurses are great at handing it out. You've seen a picture of Cherokee when I was in the northern band of Cherokee. They were giving them out to the teachers who would then go out and talk to their students about these. Early childhood learning centers. I've done a lot with Tela up to Tulalip tribes, Head Start programs, anyone. So yeah, so next slide. So housing and social services, certainly your LIHEAP programs, your WIC, energy audits and weatherization. If folks are going in and looking at homes and how leaky they are, or how much insulation they need or don't have, or what needs to happen in there, really you want to talk to also the folks about, as you increase the tightness of the home and increase the insulation and air sealing and all of that, you really have to think about what is in the home, what they bring in, what the home is made out of. And, this is an infrared camera photograph of a home I was in. And you can start to see here the leaky areas where the house is leaking heat or cold is coming in. You can also work with low-income home repair, new tenant move-in programs. A lot of tribes might have, when a new tenant moves in, they have an educational component to it. We've handed out and given out a lot of Air Matters toolkits when during that event, which helps people really think about their impact on their home and their health, and certainly emergency preparedness programs as well. Next.
And I'm just going to jump in here and say one of the things we're trying to do is that the LIHEAP, the Low Income Heating and Energy Assistance Program, WIC, Women, Infants, and Children, people doing energy audits or low income home repair, housing, emergency, these are what I call frontline. They have daily or weekly interaction with the most vulnerable. So the extent to which we can give them something, whether it's a carbon monoxide detector, a non-toxic pest trap, the QR code so they can provide it. The picture that you're actually seeing is we were doing a home assessment, but we were obviously using one of the infrared cameras, and you can see where there was moisture and cold air due to gaps in insulation. And this was just doing an energy audit, but it gave us, that was a missed opportunity to explain to that individual, that they could advocate to their maintenance staff that the insulation needed improvement. So just wanted to add that what that picture means and why we really focus on housing, social services, emergency service programs.
So in healthcare and public health, certainly virtual doctor visits, in-person visits, the kits are great, and I've trained and distributed a lot to it. The nice thing about these videos is that they're fast, they're easy, they're really easy to understand. What I've learned over time, and I've been doing this work for over 40 years, is that if you make things visible for people, they get it, they understand it. That's one of the reasons why we have a temperature humidity gauge. They can track their humidity. That's why we have all these tools, and the videos take this education to the next level, so it can really help everyone to understand why these tools, what's going on in their home, and what they can do to make their lives easier. So in terms of healthcare and public health, community health workers are great folks to train, because when they go into the homes, they can talk to folks about what they see. And if they don't have time, they download the QR code and say, take a look at this. We'll talk next time. Pharmacists, home visit nurses, community health workers, aides, all of these folks, can make an impact with somebody in their home, and especially those most at risk. Next slide.
That's actually the end of those slides, Eileen.
Okay.
So,
Okay.
thank you. And I just want to say one of the
You bet.
more exciting things we're doing is, yes, sorry, Jennifer just asked about a list of the tools. We will provide that in a follow-up email from today's webinar. So I'm going to show the videos now. We're going to try take two through a different method. Before I do that, I just want to say pharmacists have a public health kind of philosophy, and increasingly, in those of you who are professionals in that field know the term for it, but essentially they're working a little bit more on the preventive side. And what we are trying to do with them, and actually they're agreeable to it, at least in our small pilot at Tulalip, is we put a cue card with the QR code in the bag that the prescriptions come in for every asthma patient. And we're working on having them be the site for referral. So if someone has their asthma controller medication or the nebulizer or their inhaler refilled, they also then are referred to getting an air cleaner if they check no, they do not have one. So to me, it's one of the most promising strategies, because as I like to emphasize, you know, we hear from friends and family and we trust them intimately for information about our health and safety, but probably our next tier is a pharmacist, a clinician, a public health nurse, right? So I think we need to hear it from as many different pathways as possible. I think someone once told me in marketing that people need to hear things 7 times, 7 ways. Really difficult when we have short FTE, but the concept of changing a norm is when it becomes something that is echoed across different places that you interact, in your church and at your kid's basketball game and, you know, with your colleague at work. And that's when we begin to have a shift in norms.
Okay. Yeah, yat a deri minali inishnek as a thana nashna do nakaidina and bashishi tachini dashiche dot and abanele dashinale. Very quickly, that is my introduction. I am Navajo Dine from Flagstaff, Arizona. My mom's family is from Tanalea, Arizona. So a little bit about myself and the involvement in the project. So for this project, I was the wonderful voiceover person. So weird to hear my voice being played back, but you know, there's discrepancies in the audio. So this was a pretty, you know, meticulous project. We really took our time to make sure that, you know, things were executed correctly. Unfortunately, in that time, well, fortunately for me, I moved houses, so the audio got crazy. So definitely apologize for that. But yeah, I'll just talk a little bit about myself in the project with Tribal Healthy Homes Network. So this is my role here was more so not just voiceovers, but also consideration of the tribal sort of perspective. My background is in applied Indigenous studies, and I also have a master's in communication from Northern Arizona University. So really what I try to do when I approach these communication projects is encourage folks to look at tribal perspectives in a more diverse way, to really consider, you know, are we presenting this information in a way that is going to empower folks to, you know, maybe have these conversations with their clinicians. Maybe they are going to purchase something at the store, and they have that kind of split-second idea of what to do. Also in consideration, personally here on where I'm from in Navajo Nation, and what my family practices is they love bleach so much. They overuse, misuse bleach for their cleaning products. And that's because nobody ever really talked to them and said, hey, maybe if you have asthma, don't use that, or maybe only use this amount. So there's a lot of challenges, I think, when we're talking about how people from tribal backgrounds tend to approach cleaning and healthy cleaning. It can be kind of out of the norm. So that was another important project or perspective that I wanted to bring to our team here, because we are so, you know, immersed in the great work that we do and all the information that we have, that it's sometimes hard to consider other perspectives. Additionally, in my master's research, I looked at this specific sort of issue of wildfire smoke communication through social media, specifically for tribal populations in the Western United States. Not surprisingly, there's not a whole lot of information out there available specifically to tribal populations. So what the next process of this is going to be a social media sort of outreach, social media kind of plan specific to tribal populations. And what I found in my research is that a lot of natives, a lot of us, we do love Facebook. And that's kind of at odds with a lot of traditional communication practices, best practices. People don't always think that, Facebook's viable anymore, but we love it. We use it. And that is one area where people do access information, especially, with tribal councils. You'll see it on tribal pages, people getting information. So really just to say that this is just one tool in an entire toolbox, an entire ecosystem of outreach tools to help community members be motivated, to help them access information, to help them build confidence with a lot of these topics. So I'll hand it back to Gillian. Thank you all so much. I'm really excited you're all here.
So as you can see, Darian is spectacular, and she interned for us probably 8-10 years ago, and we have not been able to let her go. We're very blessed to have her continue to work with us and inform us and advise us. But before we wrap up, Tina, can you read one of the main questions there that you could see?
So I put them into the questions and answer section. One of them was, do you ever recommend dehumidifiers, especially for bathrooms without windows or fans?
Eileen, that is in your ballpark.
So this is Eileen, and I think it depends entirely on where you live and if you can put in a dehumidifier that can drain automatically to a sink or a floor drain. So the thing is with dehumidifiers, they work fabulously. Energy Star is highly recommended if you need one. They seem to be a Band-Aid, but obviously if there's no window or fan, you need a Band-Aid to get rid of the moisture. Excellent use for a dehumidifier. The thing is, if it drains right into the bucket and you have a lot of moisture, you end up emptying that bucket once a day. Knowing people the way I do and have worked with them for many, many years, that lasts about 3 days and then the whole thing shuts down. So if you can get a dehumidifier that has a hose attachment that then drain automatically to a sink or floor drain, works fabulously. Hope that helps. Happy to answer any questions anytime. Thank you.
And then the other question was, which tool or kit have you disseminated the most of?
Well, that certainly would be the Air Matters toolkit.
Well, and if it's which specific tool, people love the green cleaning. They love the moisture meter. Like you can use it for your firewood, which is one of the areas we advocate for it. So, in rural cold climate tribal communities, there's an awful lot of wood stoves, wood burning devices, even pellet stoves that are used. And of course, a large proportion are legacy stoves, meaning they're uncertified. So the moisture content of the wood is critical. So moisture meters are also a really popular one to hand out, especially when you're looking at drier wood campaigns and showing people the impact of burning wood with less than 10% moisture as opposed to uncured wood that might have 40-50%. That's really popular. The other thing I should mention is we did do a video specifically on creating a smoke safe room. We don't call it a clean room, we call it a smoke safe room. It's also, you'll see on Smoke Matters videos, it should be there, essentially showing people about using filtration in the room, sealing off cracks, sealing off the space below the door, possibly wearing a mask. That one's been our DIY fans and those, anything related to wildfire smoke, just because of our Western states focus, is huge. And I realize that, working with all my colleagues on the East Coast and in the Midwest, that lead's more of a major issue there. And I know the EPA is working to, and there's conversations about what to do now that we don't have a home lead test kit. All right, with that, I think I just want to be mindful of everybody's time. My biggest ask to you all is that we would love to mine what you're doing and learn more about your efforts in this, community of practice where we go to conferences and we have these conversations. We would like to continue this conversation with you all and with colleagues who who weren't here today that you'd like to invite. EPA has resources. Gretchen Stewart has Children's Environmental Health Month for October, for example. But I really would like to see strategies that have worked. Why or why not? I'm kind of big on, we've got good science. Let's focus on implementation science and what's working. So I'd like you to invite, if we happen to invite you to another session where it is just conversation between us all, if you're free, please feel free to join us. I'd absolutely love that, so we can do some more sharing, and didn't get to hear from all of you today. All right, with that, thank you, Eileen, Darian, EPA, Tina, Kiernan, Krista. Appreciate everything you guys have done to help make this project, and good work, everybody, and have a great rest of your week. With that, we'll go ahead and end the webinar.